Hey, hello, good morning everyone. Are you ready for the very first session of the Sushi Tech? Are you ready? I want to have more energy. Are you ready for the stage? Let's join us, encouraging the pitch presenters because they are really kind of being nervous and it's really tough to be on the first stage, right? So please help me to give a great applause to all the presenters when I start the pitch. So welcome to the 9JP Second National Network Conference in Sushi Tech Tokyo. My name is Masaru Nagura from Founders Nation. Today's MC for you. 9JP is a national platform for the all 9 platform on Japan. And 9JP is to help researchers to have support to their business, launch their business through startup. And 9JP also give the global branding to the researchers through their activity. Also, they are building a database to support investors to find good researchers around the world. So today's session, titled Researcher's Pitch, will feature 9 researchers from universities across our network. Each presenter will have 6 minutes for their pitch, followed by 3 minutes of Q&A. After all presentations, judges will make an evaluation, and the grand prize winner will be announced at 12:50. So please join the announcement session as well. Now, before we begin, let me briefly explain today's evaluation criteria. The first one is technology novelty and advantages. And second one is market and social impact. The third one is commercialization feasibility. In the first technology section, we have 3 small sub-criteria. First one is scientific and technical novelty in data utilization. And second one is the roadmap to implementation and deployment of the technology. Third one is data acquisition and IP strategy. In the market and social impact session, we have 2 criteria, potential market size and competitive advantages, and impact to the society. And other commercialization feasibility, the criteria is commercialization feasibility and partnership. Also, I'd like to introduce our sponsors and the awards that they generously provided. The grand prize winner will receive a 6-month paid subscription for Startup DB provided by 4 startups. In addition, all presenters will receive gifts from the 4 startups, NEC Corporation, and KDDI Mugen Lab. We would like to express our sincere appreciation to all our sponsors for their support. Now, let me introduce our excellent and brilliant judges. The first judges is Ben Manby-Crofton from Imperial College London. He's the Director of Entrepreneurship. Ben-san, thank you for joining us. Second one, Junji Takaoka-san, Incubation Partner of U Tokyo IPC. Takao-san, thank you. Miwa Seki-san, General Partner from Empower Partners. Thank you, Miya-san. Naoki Kamimaeda-san, Senior Advisor of Matsuo Institute and Venture Partner of IQ Capital. Thank you, Kamimaeda-san. Last but not least, Michiko Koyama-san, Founder of Startup DEI Promotion Council. Thank you, Koyama-san. We are honored to have you all with us today. Thank you so much for this excellent judge panel. So let's move to the first pitch. Each presenter will have 6 minutes, followed by approximately 3 minutes of Q&A with judges. The first presenter is Misato Ito-san from HSFC and Hokkaido University. So please join us to give great applause to Ito-san. Are you ready, Ito-san?
Yes.
Okay, stage is yours.
Hello, my name is Misato Ito. second grade of master student from Obihiro University of Agriculture and Veterinary Medicine. Today, I will talk about how we can accelerate livestock field diagnostics using portable spectroscopy and AI. Let me start with a simple question. We measure our health every day with thermometers, smartwatches, and medical devices. But what about what animals eat? We don't measure feed in real time, and that is a critical problem. Farming today is under serious pressure. Environmental instability, labor shortage and aging, and rising feed costs. At the same time, feed quality directly affects productivity, costs, and animal health. However, farmers still cannot measure feed easily. Why is feed not measured? Because the current method depends on laboratory analysis. Farmers must send samples to a laboratories, wait for days or even weeks, and then finally get results. This process typically takes 1 to 2 weeks and costs around 6,000 yen per sample.
Is clicker working?
Okay.
Oh, yes.
This is too slow, too expensive, and too late. Our solution is portable spectroscopy combined with AI. We use a handheld spectrometer to measure grass or soil directly in the field. Then AI analyzes the spectral data instantly and estimates key parameters such as nutrient contents. This enables real-time diagnostics without laboratory analysis. This technology fundamentally changes the workflow. Instead of transporting samples, waiting for lab analysis, and receiving delayed reports, farmers can now measure on-site, analysis instantly, and get results easily. So total time is changed 1 to 2 weeks to minutes, and the cost of reduced 500 yen. Our primary target is small to medium-scale dairy farmers and agricultural cooperatives. In regions like Hokkaido, where grasslands cover over 530,000 hectares, field conditions vary significantly. However, it is difficult to monitor such large areas frequently with traditional methods. The impact goes beyond speed and costs. By enabling real-time measurement, farmers can make better decisions on harvest, for example, harvest timing, fertilization, and feed formulation. This leads to improved productivity, more stable farm management, and reduced resource waste. Of course, animal health. Our roadmap is clear. In 0 to 12 months, expand POC to over 2,000 samples. In 12 to 24 months, launch beta with JA and field companies. After 24 months, scale across Hokkaido. We aim to build a widely accessible field-ready diagnostic platform. Our vision is simple. Plant and soil health as simple as a temperature check, not just providing data, but enable better decisions in the field. Thank you.
All right, thank you. Thank you, Ito-san, for your wonderful pitch as a fast pitcher. So let's move to the 3 minutes Q&A session. So judge panels, do you have any question? All right, Georgie-san and then Ben-san. Takayama-san and then Ben-san.
Thank you for your presentation, wonderful presentation. And before we evaluate anything, we would like to really understand what kind of decision making that you and your app would like to support, and what kind of actions you want the customers to take with the app. So データをですね測るのは非常によく分かりましたが、そのデータをそのお客様がですね農家の方が測ってどんな意思決定をしてほしくて、それによってどんなアクションができて、もしこのアプリがなかったらできなかったアクションですとか、それによってどんなベネフィットがお客さんにできるのかと、そういったところをもう少し詳しくお聞かせいただけると、はい、ジャッジしやすいかなと思います。
日本語でもいいですか
？Yes.
できれば英語で。
できれば英語で。So now, farmer gets results after 1 to 2 weeks. So the production getting down and the なんだろうな。So the customer changed the feed in the field. 日本語でもいいですか？
簡単に日本語で。はい。
1、2週間意思決定が遅れると、その間に損失が1000万円以上の損失が出るっていう結果が出ています。でそれをその場ですることができれば、餌をその場で変えたりとか、飼料会社をその場に呼んで添加剤を混ぜたりっていう意思決定がその場でできるようになります。
The response was by the delay of the 1 week, it will make like a 10 million Japanese yen loss to the farmers. That's why the decision making speed is really important. So next question is from Ben-san.
Am I on? Oh, yeah. Brilliant presentation. Really great slides. Really simple. I liked it. Simple question. How many farmers have you spoken with?
So, how many farmers?
何人の農家さんとお話しされましたか？
今のですよね。40人ぐらい話してると思います。
40 farmers.
40,000.
40 farmers.
40.
Yes, 40
Brilliant.
farmers.
Thank you.
All right, Seki-san, could you make the question short?
Sure. How accurate is your AI model compared to the large love grade results? And how dependent it is on the hardware, that your portables, detecting hardware rather than software?
I will make the software AI, and next step is to make hardware. So now I buy hardware from different countries, and so yeah, 合ってます。
All right, thank you. Thank you, Ito-san, for your great presentation. Yeah, please join me to give great applause to Ito-san. Thank you so much. Yeah, the time is really limited, so I'm cutting the Q&A session with precise time. All right, next presenter is Takafumi Kubota-san from MASP, M-A-S-P. That is from Tohoku area. Kubota-san, please come on stage. Are you ready, Kubota-san?
Yes.
The stage is yours, please.
My name is Takafumi Kubota, a neurologist at Tohoku University. Today, I would like to introduce Purple, a personalized medicine platform combining genetic testing and AI drug selection. Our purpose is achieving well-being life for patients with epilepsy worldwide through optimal treatment and support. Please watch this video. This is an epileptic seizure. seizures suddenly occur
Guys,
and
this room is
disrupt
having a seizure.
their lives.
Okay. Stay calm. It's gonna be fine. Help me get him on his side.
And epilepsy is very common brain disorder. 1 in 30 people develop epilepsy. Actually, my brother had epilepsy. That's why I became a doctor and started this project. Epilepsy patients face serious challenges such as driving restriction, employment restriction, even sudden death. Unfortunately, 40% of patients are drug resistant, failing 2 medications. For drug-resistant epilepsy, we tried about 30 medications one by one. Each medication often takes more than 1 year. Sadly, for drug-resistant patients, this trial-and-error approach takes decades, creating long treatment odyssey. So we finally end this long odyssey. Our AI genetic testing finds the cause in 60% of drug-resistant epilepsy, integrating whole genome data with clinical data. Then, our AI agent cuts literature search from 1 hour to 10 seconds. Let me show you the prototype. Our AI agent searches the multiple data sets for evidence of gene and drug and integrates the evidence. Then we show the gene summaries and the contraindicated medication and the recommended medications. Our mission strongly resonates with patients and caregivers. Through crowdfunding, we achieved 700% of initial target, supported by families, patients, and healthcare professionals. One caregiver wrote to us saying, "This is our hope. This message clearly reflects the unmet need we are addressing." Our advantage is about 60% of detection, 3 times higher than others. And our AI agent finds the best treatment in just 10 seconds. This is a large and growing market. Globally, there are about 22 million patients, representing $17 billion. Our initial targets, epilepsy centers in Japan, represent $0.5 billion. Purple is a multi-site platform. We provide genetic testing to hospitals for $2,000 per test. And we partner with pharma, offering high-value data starting at $10,000 and clinical trial support for $1 million. Our team brings together clinical experts, genetic professionals, and medtech experts. Roadmap is clear. Preclinical validation followed by clinical trial and regulatory approval in Japan and Taiwan. Next, expansion to the US. Now, we are already working with Sysmex, a M&A potential partner. So we are raising $500,000 for 10% equity at the seed stage, targeting $50 million exits within 5 years, offering 10x return. We aim to deliver genomic profiling to 500,000 epilepsy patients by 2030s and end the long treatment odyssey. If you are interested in joining us as an investor or supporter, please reach out. Thank you very much for your attention.
All right, thank you so much, Kubota-san. Let's move to the Q&A session. Is there any question? Koyama-san, please. Then Kamimaeda-san.
Thank you very much for your presentation. I always believe that an entrepreneur is valuable when it comes to the soul. So hearing about your brother made me convincing. It was very convincing to see the story that you've made so far. And seeing the evidence so far, I think you have come quite far. My question would be, what do you see down the road as business risks? Because I understand that you do have a clinical test in Japan, but when you're going to the US and other regions, what kind of business risk do you see, and how do you think of mitigating that as growing your company?
Thank you for your question. So let me clarify your presentation. So business strategy in the US. Yes.
So yes, from the roadmap, you said that
Yes.
first step is Japan, and then you're thinking of expanding to other regions.
Yes.
I think the evidence itself is very promising, but I think there's always a business risk of going out to different regions.
I see.
So
yeah.
I would like to understand your
Thank
strategy
you for
and
your
what
question.
you're thinking.
So we will partner with KOL in US. So this year, end of this year, so we contact and we started research with Stanford University, and then we will expand this network in the US. And we are thinking about getting FDA approval as well.
Thank you.
Thank you. From the speakers, the voice quality is not really good, so
Yes,
please
sorry.
speak slowly. Then the presenter can hear you. Then Kamimaeda-san, please.
Thank you very much for your impressive presentation. I think this technology is very amazing. My question would be, actually, my question is, when you go through the FDA process, how tough would it be, and how many patients do you need to recruit? And depending on that, compared to other, for example, medical-related companies, the funding plan you are planning to raise will be relatively small. So that's why is it?
Oh, thank you. So now we are humble, but we try to go bold. So I think we need at least 100 patients, enough. So in order to get PMD approval in Japan, we are making a protocol for clinical trial, and we're referring to previous similar researches, maybe 100. So, but we aim to more than 100, such as 200 or 300 people.
Thank you. Is there any other quick question? You good? Takaoka-san, please.
Thank you for your presentation. Just would like to know, since I'm not familiar with this drug and this, epilepsy stuff. So how often and do the patients have to take this drug regularly, or because epilepsy happens, just accidentally, whenever they don't think it happens, right? So how often, what is the regular medication process of this drug?
So regularly, patients daily takes medication, maybe like around 5 medications or 10 medications, and vary a lot. So we would like to optimize the matching and the process.
All right. Thank you so much, Kubota-san. Please give a great
Thank you very
applause
much.
to Kubota-san. Thank you so much. All right. It's a wonderful pitch. So let's move to next pitch presenter. Next is Shin Hegeta-san from IG, or that is from Koshin and Northern Kanto area platform. So Hegeta-san, are you ready? Okay, the stage is yours.
Okay. Ladies and gentlemen, audience in audience, thank you for your interest in this presentation. My name is Shin Higeta, visiting professor at Utsunomiya University. I'm not good at English, so I read from paper. As the urban planning laboratory of Utsunomiya University, under the leadership of Professor Omori, we are conducting AI dynamic monitoring development.
Is clicker working?
よ
そうですね、クリッカーが動いてないので。
来ないね。いけ。Okay.
Okay.
いいですか
Sorry, we are changing the clicker.
Okay. And
Yeah. There's another clicker coming from backside. Okay, let's start another 6 minutes.
okay, restart. As the urban planning laboratory of Utsunomiya University, under the leadership of Professor Omori, we conducting AI dynamic monitoring development. This research has secured opportunities for dimension in the central urban area through two urban regeneration promotion corporation located in Maebashi and Utsunomiya. Additionally, in order to implement device in under the area, we receive cooperation from major infrastructure and security companies, Tokyo Electric Power Grid and ALSOC. Furthermore, on the AI technology side, Libertas Advisory participating. This research and development team will collaborate to not only technical aspect, but also in business development and major strengths in ability to leverage this sales networks from Tokyo Electric and ALSOC. This AI dynamic monitoring development aim to quantitatively give the movement dynamics of people and vehicles in town and the field of urban planning. It seeks to utilizing traffic movement data which has tended to remain limited to traffic planning for purpose such as revitalizing city areas. In the traffic volume survey in commercial area and streets, it is common to see people sitting on folding chair, counting traffic counts with manual counters. On the other hand, on major national highway, monitoring is carried out using heavy equipped specialized device. In analog traffic survey conducting in commercial area and street, measures can only be taken during limited periods or time. Although such survey conducted in almost municipality networks, there unfilled national standard and survey period and time vary, making intercity comparisons difficult. Because the amount of data is limited, is also difficult to gauge long-term change as a result and effect by weather, social events, and other factors. Our AI data monitoring development screens the general security camera data using AI. It allows seamless monitoring of traffic dynamics 20 hours a day, 360 days a day. These things that pass through the camera field view or infiltrate people or vehicles, and data such as time, regression, and speed, and stored in cloud database. I have demonstrated in private sector development of public area in Maeba City, Gunma Prefecture for 5 years. This effort has numerous across, including the Prime Minister's Awards and 2 Ministry of Land Infrastructure, Transport and Tourism Awards. By combining AI dynamic monitoring development with a central urban area, Liberty's initiative in become possible to customize project.
Higata-san, can you wrap up the presentation?
Right.
Yeah, please go to the final sentence of the presentation. Is clicker working?
Okay.
Yes, please conclude the presentation.
Okay, last slide. In this field, products such as cloud surveillance solutions and behavior analysis solutions compared with each other, all of which are high value added service afforded by major companies. In contrast, our AI data monitoring development provides from simple and inexpensive service with a wide reach.
Are you okay?
That's all.
Thank you, Higata-san. Please give a round of applause. Again, the direction of the speaker is not ideal for the presenter and not really easy to listen to questions. So please speak loudly and slowly. So judges, please have the question. Seki-san, please.
Great. Thanks for your presentation. So if I understand correctly, you collect pedestrian flow data through surveillance cameras. And that raises privacy and personal information concerns. And how do you get around that? And how do you proceed with that legal framework?
Yeah, it's an important point. Privacy. It's an important point. Yeah, but this solution is screening from not personal data, time, car or man, direction, that are not touch personal data. And we strong point is this project made by National University. We can clear that problem.
Okay, Ben-san.
Hello, can you hear me? Excellent. Thank you so much for doing that in English. I'm humbled and honored, and that's really, really tough. I'd be here all day if I was doing it in Japanese. Simple question. What intellectual property do you have here? What can you protect?
知財はどんな知財がありますか？どういうふうに守りますか？知的財産、特許とか。
Okay. Not so. Maybe we tried software. ソフト的なところで知的財産を守っていくということと、それからその国立大学の研究室がこのデータを扱うというところで排他的なポジションを獲得したいと思っています。
The IP is in software, so there's no patent, but they protect their technology by a software. And also dealing the data as a National Research Institute, the data is protected is a response from the Higeta-san. All right, the time is up. Thank you so much, Higeta-san. And let's try to pitch without description next time. All right, let's go to the next pitch. Next is Kenji Suzuki-san from GTI or GTIE platform. That is a Greater Tokyo Area platform. So Suzuki-san, are you ready to give the pitch? Okay, the stage is yours.
So I am Kenji Suzuki from Science Tokyo. We bring AI-powered diagnosis to every patient. So everybody uses AI now. You all know that AI can exceed human performance, but it happens only if we have big data. It has long been well known that at least 100,000 samples are indispensable for AI development. What if I say we can develop AI with only 100 samples? This is something called small data AI we developed in medicine area. Think about your family, kids, loved one, and yourself. 7 in 10 people die from some disease. Studies show that medical AI can improve performance of doctors in mammography. So AI can save 20% more breast cancer patients. This is wonderful news for all of us, but in reality, medical AI has not reached most patients yet. Only several major cancers have FDA-approved AI for diagnosis. In other words, 400,000 patients of 200 cancers are left behind every year from the AI benefit. So why is that? AI required 100,000 annotated cases. It takes several years to collect. It needs medical doctors to annotate them. Also, it runs only on expensive GPU servers. So the big data and GPU necessity is the bottleneck. Our solution is our original ultralight small data AI. It's called Massive Training Artificial Neural Network, MTAN. It's clinically deployable, patented technology evidenced by multiple FDA-approved products. Massive patch training of minimum architecture enables small data training less than 100 cases. It's also computationally super efficient. We don't need GPU server. It runs on a tablet. So this is current status of FDA-approved AI product in red. As you see, other than several major cancers in big data area, 200 more cancers in small data area are in blue ocean. To show the ability of our innovative small data AI for covering rare to major cancers, we developed the AI for extremely rare cancer on the right edge, synovial sarcoma. We use only 22 cases for training our small data AI. Those 2 images you see are very difficult cases because too rare. Our AI predicted for the left case as malignant with 66% malignancy likelihood correctly. So the accuracy reached at 84%. So the 80% for potential misses can be avoided. This is AI app on a tablet. AI prediction shows up like this, which prevent a doctor from missing this extremely rare cancer. Right now, if you want to use AI, you have to install multiple AI workstation from multiple vendors on the GPU servers. But to use our AI app, individual doctor can just download it on a tablet, and you will be simply charged by use or subscription like Netflix. So the doctor can use AI anywhere, anytime without GPU. So our anywhere, anytime AI revolutionized medical AI. This bottom-up business model extend time to add a large number of hospitals and clinics. We soon established AI startup in Japan and US. We soon begin PFDA application for the 8 AI developed with leading Japanese hospitals. Because the US holds 50% global market, we soon bring our AI to the leading US hospitals, including Harvard, to obtain FDA approval for the US market. Our team is all US experienced, combining the experienced business team and a strong R&D with clinical collaborators, with me as CTO. So our startup aim to bring the world where medical AI reaches every patient equally, including real patient. Join us, let's work together. Thank you.
All right, thank you so much for a great presentation. Let's move to the Q&A session. Kamimaeda-san.
Thank you very much for your incredible presentation. Your small AI model, MTON, sounds really powerful. So then my question would be, so why is it possible with only 100 data? Is it your unique proprietary technology? And one other question is, how can you make sure it is not overfitting with your training data?
So we use unlike other deep learning model, we use image-to-image training. We divide the case or image into a large number of sub-regions or image patches. This massive training of sub-patches enables to fulfill the requirement of determine the number of parameters in the model. And also, our model is very small, compact, 5 times smaller or 1,000 times smaller than the large model. So that ensures that the training of small data, that is possible to make the small data training less than 100 cases. That is the key.
So one more question is, so how can you make sure it's not overfitting?
I'm sorry, that is good point. Basically, that massive patch sampling strategies makes the lowering the chances for overfitting. We tested on more than 20 applications, and we didn't observe any overfitting.
All right, let's go to the question. Next question. Seki-san, you raise your hand? Yes, Seki-san,
yeah, I was going to ask the same question, but a little bit more on the technology. So if I understand correctly, your technology learns an image pixel by pixel, really small pixel by pixel, than the whole case. That's why you can predict with a smaller data than the large number of cases. But how can you do this pixel by pixel training in other platforms cannot?
So basically, we do the sampling the patches from the images, and that is actually the uniqueness. The other deep learning models, such as the convolutional neural network, you converse with the entire images to use the entire the data and the pixels, but we sample the pixel, sample the patches pixel by pixel. That enables to focus on really important things. That is the key to our small data learning model.
We can take another really quick. Ben-san. Sorry, Koyama-san.
Sorry, really quick question. I love the idea of small data. That's so catchy. Follow-on question there, the issue of trust. So will clinicians trust the results given that it's generated from small data, if that makes sense? So I guess my question is, is it believable? Is that an issue for you in terms of clinical adoption?
So you are concerned about because of the small data sampling, and can you generalize our model to the more general population? And that is what this question.
the question, because it's small,
Uh-huh.
Will you have an issue with clinicians or doctors trusting the tool that you're using or trusting the results?
I see. So the validation has to be large number of cases as much as possible. That is the basically FDA process goes through. That when you get the FDA approval, that ensure that the safety and effectiveness. So for the general population. Because of that process, often the doctors believe in that. The technology because of the FDA approval.
All right, Suzuki-san, thank you so much.
Thank you very much.
Yes, join me to give a great round of applause to Suzuki-san. Thank you so much. All right, let's go to the next presenter. Next presenter is Fuji Keisuke-san. Keisuke Fuji-san from Nagoya University. He's from Tongari platform. That is a platform from Tokai area. So Fuji-san, are you ready? All right.
Hi. Yes.
Stage
yes.
is yours.
Hi, this is Keisuke Fuji from Nagoya University, Cyber Agent, and Japan Football Association. So let me introduce multi-agent AI in real world. In particular, convert a soccer video to tactical decisions. The last year, I have released a book for AI in sports and attracted worldwide attention on LinkedIn. The problem is that sport teams can record videos, but they cannot often turn them into decisions. For example, amateur and semi-professional teams has usually only video and spend time on manual video editing, but they cannot often reach quantitative analysis. In contrast, professional teams has richer data sources and metrics, but the data is fragmented across vendors and formats. In both cases, they cannot still easily convert them into decisions. Our solution is a no-code AI platform covering the full workflow. First, Vision Board generates the structured data from video. And second, OpenStar Lab integrates the heterogeneous sports data into common format for analysis. Third, Agent Suite evaluates the play and suggests better actions for the teams like this video. Like this video. And the point is that existing tools are separately solve each problem, and it takes much human cost. Our platform effectively and automatically integrates each module and converts video to decisions. We can win technically for the following 4 reasons. First, a video analysis is designed for downstream tactical use rather than the benchmark performances. Second, we've already published open platform for data integration and attracted attention more than 20 organizations. Third, we show the full scene evaluation not only for isolated action, but also for all players, like this video, with 1 patent. And this project is built on research, more than 120 papers, and based on the real correlation, such as JFA and multiple soccer teams. This is our productization path built on a technical base. For the user, the value is a usable decision support. The real value is that the video, structured data, and evaluation results are integrated in one interface. Coaches and analysts can review the video and data, check player positioning and play value, compare alternatives, and receive the specific feedback. The value for the users are less time for review preparation, more objective discussion, less depends on humans, and better actions. The strength of this approach is that it's not only the automation, but also usable decision support. Our commercialization logic is open core. We have open layer as a standardization and integration layer for more people to accelerate adoption and ecosystem growth. our data strategy is that customer data stays under customer control and our proprietary value accumulates in the decision support layer as a service templates. We monetize the proprietary layer, such as team-specific evaluation, workflow automation, and reporting and operational support. This is our open core model. Openness drives adoption, and proprietary layer capture values. Our team has mainly 3 roles. First, I will lead a company as founder with AI and sport expertise. And business lead covers product design and commercialization. And researchers and engineers support rapid development and implementations. Over the next 12 months, we will build an MVP for BDA to decision workflow, and will run POCs and measure and operational values in the field. Finally, we will prove that teams actually use the product, review time is reduced, and pilot teams can become repeatable paid adoption. This is our team and path to repeatable paid adoption. Our roadmap is disciplined by step. This year, we aim to validate the beta with pilot organizations, and the next year, we will formulate a company and introduction to 30 organizations in domestic soccer amateur teams. After that, we integrate each module in one suite with multimodal AI and expand to global sports and beyond sports. Our long-term goal is to make movement knowledge accessible to more people rather than the small number of professionals. Thank you for your attention.
All right, thank you so much. Okay, let's move to the Q&A session. Koyama-san, please.
Thank you very much for the presentation. I've always thought that sports and AI is a very good combination. My question would be more close to the go-to-market strategy. What kind of soccer team or like team size are you aiming for? Is it a major or like a mid-size or an amateur? I mean, depending on that, I think the cost that they can pay is different. Another point would be, you said that soccer is your first step, but how difficult is it to expand to other sports going forward?
Okay, thank you for your question. So as a first question, so that is a good question. And so the major teams has money, but they employ the analysts, many analysts. And we want to automate this process with more more number of teams and less budgets. In that sense, so very competitive amateur or semi-professional teams. So this is our first reason. And the second topic, actually soccer is very difficult sports, but they collect money, and so in that sense we can also apply to other sports like basketball, handball, like very difficult, challenging team sports. So it's fine.
I guess my question would be, how difficult is it to adapt your technology to other sports? So the more sports you have, I think the more revenue you can generate. So just trying to understand how difficult that you can leverage your basic AI.
So the adaptation to other sports is, I think it is not so difficult. So this is a budget and market problem. So if we show the difficult soccer, so it is very useful, and that can be easily lead to other team sports.
We can take one more question. Ben-san, please.
Thank you. That's a really good presentation. Following on from the last question, why would you start with soccer, football in the US? Why not start in the UK or Europe, where you have lots and lots of semi-professional teams? I'm just, why the US?
Why US?
Yeah.
So actually, honestly speaking, we have less connection to the US and Europe. And actually, we have talked to 30 or 40 teams in Japan. So as a first POC step, I will select the Japanese soccer team, but we want to, we are ready for the expand to US or Europe if we have opportunity. Yeah.
All right, thank you so much, Fuji-san.
Thank you.
Please join us to give a great round of applause. Thank you so much. All right, that is the first half of this pitch session. Now we're gonna move to a short break. We're gonna have 4 minutes break, and we're gonna start at 12 p.m. 正午から始まりますので、それまでに席にお戻りください。Okay, please take a break.
We will be resuming shortly. Please return to your seats. Thank you.
Yeah, we will start really soon. Once Koyama-san is back to the seat, we will start the second half of the session. All right, thank you for getting back on time. We're gonna start the second half of this 9JP researchers pitch session. So the top presenter, the first presenter of the second half will be Chiaki Matsuzaki-san from TESH, T-E-S-H. That is platform for Hokuriku area. So Matsuzaki-san, are you ready?
Yes.
Okay, the stage is yours.
Thank you very much for introducing me, Nagura-san. I'm Chiaki Matsuzaki, and I'm so delighted to be here and to have a chance to give a presentation for our Qualityzyme project. Stable enzymes pave the way for the new era of your company. Do you like Japanese cuisine washoku? It contains many health beneficial enzymes that produce pharmaceuticals, seasonings, and functional food ingredients. So Japan has extensive experience for enzyme research. Today, enzymes are used, and enzymes are essential biocatalysts in various industries. However, although many beneficial enzymes are known, only 1% can be applied for industry. Why? They are fragile, sadly, and not stable for industrial use. Many industries require stable enzymes. Reported market size is $14 billion. However, Japan's largest enzyme company, Amino Enzyme, reported that the actual market size is 10 times as much, $114 billion. Why? Because crucial enzyme of big companies are not on market. They are not counted. So you will see a big broad ocean of business opportunities. We can make enzymes stable. We use molecular models for design and supercomputers to calculate the enzyme stable energies. Using molecular models like this, we introduce interatomic leakages as shown by a yellow dashed line. This technology is our combined result of 30 years research. To accelerate our development, we use supercomputers and calculate the energy of stabilizing energy. So we can design stable enzymes more quickly. So what happens? Enzymes are stabilized. They are effective for a longer time. The productivity is increased, and they are stable at the harsh conditions. Typically, computational simulation doesn't incorporate the theoretical design skills, so the accuracy is low. So customers have to conduct long-term experiments to achieve enzyme stabilization. By incorporating the theoretical design skills, the Qualityzyme enables the high accuracy enzyme design. Other startup companies have crucial skills to discover new enzymes. However, their method is in low accuracy enzyme stabilization. That's our expertise. 3 enzymes have already been applied for industry. In this case, the company's annual sales had been increased by $3 million. This is our proposed revenue models, combination of revenue models, initial payment and milestone payment and royalty fee. We stabilize customers' enzyme or propose the option of using our original enzymes. By integrating our skills, our technologies, we can make stable enzymes more quickly. That boosts the sales. Our next target is pharmaceutical industry. This is our team. We are supported to venture capital companies. We are looking for co-founder to lead our project. Do you want to accelerate the development of your new medicine? Don't you want to deliver your product without a cold supply chain? Do you want to achieve dramatic cost savings in production? Contact me. Thank you very much for your attention.
All right, thank you so much, Matsuzaki-san. Let's move to the Q&A session. Judge panel, do you have any question? Kamimaeda-san, please.
Thank you very much for your presentation. So my question would be, so when you do simulation using a supercomputer,
yes,
how long would it take to get the final result, and how many iterations would you need to do to kind of get the feasible result to suggest the actual customers?
Yes, thank you very much. Now we are constructing the simulation steps. Within 1 month, we can give the customers.
So in that case, how many iterations do you do with supercomputers?
How many, sorry?
How many iterations? Of course, you need to try and error many times, right?
Within 2 years, we completed this system. And after that, we can provide if I could finalize the refinement. Thank you. Yes, I'll show.
Yeah, please keep it short.
Sorry.
Yes.
Sorry. Now we are refining using our actual data, and now accuracy is now 50%, and within 2 years, the percent accuracy is 100%, because we have actual data, so using it, we can improve the accuracy.
Okay, let's move to the next question.
Thank you.
Ben-san.
Brilliant, really good presentation.
Thank you.
So don't worry about going from slide to slide, just answer the question, because it makes you more nervous. Yeah, and so just answer. My question, though, it's not just a comment, it's what's the biggest commercial barrier to scaling this business?
We have strong relationship between the food company and biofuel company, but I have little relationship with pharmaceutical companies. It's a big restriction, so I have to resolve the problem.
So is that then, so you know how to expand in food, but moving beyond food is harder because you don't have commercial experience?
Sorry.
So, sorry, it's the answer sounded like you have experience in food,
yes,
but not the contacts outside of food, so pharmaceutical or other industries.
And I will expand the other industries.
Okay.
Yes, yes.
Thank you.
Thank you.
All right, thank you so much, Matsuzaki-san. Thank you. It was a great presentation. Okay, let's move to the next presenter. The next presenter is Ken Umeno-san from KSAC, KSAC. That is a Kansai area platform. So Umeno-san, if you are ready, please start your presentation. The stage is yours.
Good morning. My name is Ken Umeno from Kyoto University. I represent not not a new research, not a new scientific, new technology, but a new paradigm shift in disaster resilience. The scientific question is broad. Can space weather and atmospheric disturbance can help understand risk before a major earthquake? The core paradigm shift is simple. Today, most earthquake early warning systems are triggered after seismic waves are detected. That is variable, but it means the event has already started. The new paradigm is not to claim deterministic prediction. It's to raise the risk level in stage before catastrophic rupture based on validated scientific anomalies. This is the scientific heart of the story, but the wording must be careful. The sun does not create earthquake energy. The tectonic energy is already stored inside us. Our hypothesis is that when the fault system is already near critical stage, external electromagnetic and atmospheric disturbance like this affects the result, the triggering earthquake. This slide explains why the research is not a simple solar flare correlation. The same flare intensity can have different effects on local time and atmospheric state. A morning condition, a noon condition, a nighttime condition can generate different atmospheric responses. The figure shows the Noto Peninsula in 2024 case as an illustrative timeline. The key point is not claim the flare supplies the tectonic energy. The key point is timing relationship and the possible pathway, X-class solar flare, energetic particle, and atmospheric disturbance over Japan, and then a major earthquake about 9 hours later. So there's an implementation bottleneck. This is a bridge from science to implementation. If a signal appears before an event, the first question is, can we prove when the observation was made? Without trusted time, we cannot validate time. Without validated real time, we cannot build operational trust. Here, the architecture becomes concrete. The bottom layer is observation. Above that is high precision time synchronization. Above that is the trust layer, post-quantum cryptography and tamper-resist timestamp. The upper layer is action layer, risk escalation and dashboard for infrastructure and cities. This is a collaboration slide. We have already several domains to collaborate. Our model already spans multiple domains, and they are central represent mission critical transportation infrastructure and operation resilience, like Shinkansen, as you know. Gamagori City in Aichi Prefecture provides a municipal implementation model for local disaster preparedness. Tokyo has a direct reason to lead because metropolitan earthquake resilience. By investing in trusted time infrastructure now, Tokyo can strengthen its ability to stay operational, connected, and cooperative even when a major metropolitan earthquake strikes. This slide turns a vision in concrete collaboration program. In the first 3 months, we formed the consortium and defined data governance. From 3 to 9 months, we integrate receiver and relevant data sets. For 9 to 15 months, we build a trusted timestamp prototype and validation. Let me close with the main message. This is not only an earthquake prediction. It's a new trusted time for foundation for resilience in the quantum era. Scientifically, we aim to validate physical precursor signal and conditional ionospheric four-state system. Technologically, we aim to synchronize and certify observation with post-quantum trusted timestamps. We invite government, infrastructure operators, research institutions, device makers, cybersecurity experts, finance and insurance partners, and strategic investors to join us. Thank you very much.
All right, thank you so much, Umeno-san. Let's move to the Q&A session. And judges, please be very loud because the direction of the speaker is very long for the pitch presenters. So Takaoka-san, please.
Yes, thank you for your presentation. It's a very ambitious and very, wild idea. And I think the first thing that you say you do is to get the consortium ready. And I think you've been working on this already for a certain amount of time. But what are the challenges that you are facing when you are trying to involve all different parties? And how, maybe this year or next year, you are trying to solve all these challenges?
Yeah.
If any, yeah. If you have no challenges, that's better. But yeah, please.
Thank you very much. There are many hurdles to create a consortium. Yeah. But one most challenging part is Japanese government does not believe in this technology. So this is the most heaviest hurdle. But we have already paper and patent technologies. Now data will prove this fact. So we take effort in accumulating partners. Thank you very much.
Thanks for the great response. Any other question from judge panel? Seki-san, you want to go?
Okay.
Seki-san,
so
please.
The government doesn't believe in your technology, and how do you secure the data you need for an input?
That security is a very important point because it is very mission. This is related to very secret result. For example, Nankai Trough earthquake. So that is that might be a possible signal to tell us danger. So we need post-quantum securities to implement data securities.
All right, let's conclude this session. Thank you so much.
Thank you.
Yeah, please give great round of applause to Umeno-san. Thank you. Okay, let's move to the next pitch. The next pitch is from Takafumi Shimizu-san from PSI platform. That is a Chu Shikoku area platform. Shimizu-san, are you ready for the pitch? If you're ready, please start.
Okay. Good afternoon, everyone. My name is Takafumi Shimizu from Shimane University. Today, I would like to introduce my project, AI-driven thermal performance evaluation and energy optimization for buildings. Our vision is so simple, to create a comfortable environment for people and a new value for the industry. Let me start with housing problems, housing examples. So now in Japan, so we have cold situation in housing, and it's not uncomfortable. Heat escape from envelope of build housings, and especially windows and walls, and additionally ceilings and floors. I believe so. This is one of the reasons. So why so many vacant houses in Japan. So now more than 7 million houses is vacant. So, of course, insulation renovation can help this situation. However, it's expensive. So, can we identify where to put insulation materials and where we should insulation boundaries in the housings? Now we have to tell no. So this is the existing technologies situations. That requires time consumption and costly and human powers. Because many equipment is required and long-term measurement is required. This is our new approach. So upper sides conventional method. This is required at least 5 steps. So initially, experts should collect data, and they should analyze material properties. Additionally, they have to create a breeding model, and they should input those properties. And finally, they can calculate, and they can get results. On the other hand, in our method, we can collect with environmental data with simple sensors. Additionally, we can calculate with using with AI technologies. So finally, anyone can get easily simulation data. This is our core technology. So our technology is not the sensors. Of course, we will use simple sensors to measure temperature and humidity. For example, this is center room 1 is a targeted room. We have to evaluate, when we have to evaluate this summer insulation performance, we'll set other rooms and outside. So finally, AI analyzes each relationships, and we can get the results. This slide shows our technology validity. So left hand, how much measured data, predicted data is matched. Almost 95% we can get accuracy. Right hand, so this is unique our proposal as a result. So which room is affected to room 1 and room 1. Upper side is a thermal environment. So bottom one is air tightness. This is our business model. Our technology is our solution is based on AI-powered platform. So left hand showing the how we collect the data. So now we are collecting by ourselves. However, so we can ask the collaborator to collect the data. So next, this is our core technology. So we can analyze these collected data. And finally, we can deliver these 4 key values. And our expected user is house owners, is property owners, additionally municipalities. This is why now. So we can pick up 4 reasons. So now growing demand for building performance evaluation, and second, increasing expectations for construction industry. Third, strict energy regulation and policy pressures. Fourth, rapid adaptation of AI and technological advancement. And why us? So we have these 3 kind of career and experience. First is so building, testing, inspection skills. And next, we have the industrial side experience as well as a staff of R&D Center. Now we have academical experience also. So this is so unique career. So we can provide several important values. So let me conclude. We are making breeding performance visible and actionable. So we can achieve these 4 items for each various stakeholders. So now we are looking for collaborator and to adapt our technology to various building and not only housings. Thank you very much.
All right, thank you so much, Shimizu-san. Please give a round of applause. So let's move to the Q&A session. Koyama-san, then Kamimaeda-san.
Thank you very much for the presentation. I mean, with the environment to change, I think you're tackling a very interesting point. Looking at your slides, my question would be, who are the people that will be willing to pay initially I understand there is a whole business market that you can address, but who are the real paying person for you?
So our technology can adapt it to newly constructed buildings also. So of course, so many architect design office provides simulation data, how much that and how much energy consumption will be required. However, now we don't have any way a method to evaluate that simulation results how much accuracy. So we can inspect that accuracy as well. So now, for example, so at least building housing renovation market is more than 1 trillion yen. So initially, I want to target that minimum 5% of that. So now we cannot identify how much this market is bigger. Yeah.
All right, Kamimaeda-san.
My question is also related to kind of go-to-market. So what kind of if once you decide to tackle this kind of renovation market and so on, so what kind of partners are you actually looking for?
Yeah. So we can target several stakeholders. So initially, of course, housing manufacturer and constructor. So now, Japan government and local government has to ask to them to reducing energy consumption in housings. So other housing owner, they also have how much they want to know how much their house kind of asset has value also. So we can target several part of people. So of course initially, so construction company is better for us, I think.
All right, thank you, Takaoka-san, please.
Thank you. One quick question. So your project is now collaborated by Day1 and another company.
Yeah.
What's your IP structure? Is the IP related to this project shared by these two companies, or how would you when it comes to incorporating a company in the future, what's your strategy on that?
We have already submitted patent in Japan. Because of financial limitation, we couldn't submit the international one. However, now we are getting this technology and accuracy, and so now we have collaborating several countries people, so Italy and Netherlands and Germany and US and Australia also. So now when we can collect these data, so and having connection these countries, so we can approach easily several corporation and peoples. I believe so.
Is it an individual application or Shimane University application, or is it applied by a multiple of inventors?
Now
included or other companies included?
Now we don't limit. We don't have to limit in local area. Now we are targeting these vacant housings. There are so many vacant housing in Shimane Prefecture. So now we are targeting that. We want to improve the local environment and economical situation as well.
All right, thank you so much, Shimizu-san, for your great presentation.
Thank you very much.
Round of applause to Shimizu-san. Okay, let's go to our last pitch. It's really quick, isn't it? So the last but not least, the presenter is Masafumi Inomata-san from Parks, P-A-R-K-S platform. That is a Kyushu, Okinawa-based platform. Inomata-san, are you ready for the pitch?
Okay,
the stage is yours.
Hello everyone, I'm Masafumi Inomata, Oita University, Parks in Kyushu. I'm a surgeon. Every day I stand in our operation room, university hospital, to make a life and death decision. Today, I'm standing in here to save the crisis of surgeon and medical care. Surgeons are overwhelmed, and medical care is under strain. Let me introduce the smart operator. Smart Operac, transforming surgical record from burden to asset. Our mission is simple: to improve healthcare quality while solving workforce challenge at the same time. Let me explain the background. Surgery continues to advance, but documentation is still manual. Surgeons spend valuable time on paperwork, often relying on memory after long operations. At the same time, requiring increasing while working conditions are declining. The biggest bottleneck is surgical report. Smart Operac resolves this problem by analyzing surgical video using AI and automatically generates structured medical record. Our system integrated visual AI, decision modeling, and medical NLP. Now is the right moment for this innovation. High-resolution surgical video is a standard. AI technology has advanced rapidly, and standalone software is widely accepted. This is a largely untapped market. We start with automated surgical documentation, a focused segment of about $50 million. Most existing solutions do not understand the surgical decision. Smart Operac does. By establishing a standard in this niche, we expand into endoscopic AI and the broader surgical AI market, scaling globally. Smart Operac is not just a documentation tool. Our three-layer architecture enables standardized decision-level documentation, and this system improves itself with accumulated data. This creates a strong competitive moat. We validate our system using laparoscopic cholecystectomy, worldwide most common disease. A conventional reporting takes about 80 minutes. With Smart Operac, it takes about 50 seconds. This enables fast, objective, and consistent documentation. This slide shows how we capture the SOM. Our approach is a customer-driven development based on surgeons and hospital needs. Existing solutions are surgeon-dependent and focus only documentation. Smart Operac enables AI-driven decision and standardized automated documentation. We don't just record surgery, we structure. Smart Operac generated objective structured surgical data in real time. This enables data-driven risk prediction and strengthens legal protection through accurate record. It also improves operational efficiency and cost performance. Ultimately, this leads to high-quality efficient. We start with joint research and POC from 2026, then expand through OEM and partnership first in Asia, then globally. We are building a globally scalable platform for surgical data and decision support. Our founding plan progresses step by step from POC to commercialization and standardization. Through digital transformation, we generate objective surgical data. This enables data-driven prediction of complication risk and strengthens legal protection. We also reduce work by 1,000 hours per year, cut cost, and optimize structure. Ultimately, this leads to high-quality, efficient healthcare. Our vision is to transform surgical data into valuable, reusable assets. Please join us in our project for patients and surgeons in the world. Thank you very much for your
All
attention.
right. Thank you so much, Inomata-san. Let's move to the Q&A session. Judge panel, Aseki-san, please.
Thanks for your fascinating presentation. One question I have is how willing will doctors and nurses will be to be recorded in their operations room? It can protect them from legal battle, legal lawsuit, but also it can be used against them in the lawsuit.
Doctor, surgeon, and nurse and medical staff is overframed in Japan and all over the world country. However, surgical treatment is advanced and complexity. Which we need to save surgical condition in operating room.
All right.
Okay.
Is there any question? Additional question? Kamiwada-san, please.
So you said the current existing solutions are not enough and that they don't do this kind of AI-supported decision support and so on, but why existing companies or solutions cannot do what you are doing?
Okay, it's very important question. This technology is produced in our team in our university, collaborated Japanese, supported by Japanese medic government and project. I had the patent. Most important issue is to know the medical problem, surgical crisis in the world. Okay.
Okay, quick question, Ben-san. Very quick one.
Great presentation. What's your biggest risk over the next 6 months?
Risk?
Biggest risk over the next 6 months to this going forward?
I need to get the money in 6 months.
It's always about the money.
Money. Technology is here. Money is needs.
Okay, thank you.
All right, Inomata-san, thank you so much.
Thank you very much.
Please join us to
much.
give the great applause to Inomata-san. All right, that is 9 pitches. I hope you enjoy all the pitch presentations. And we will now go to the judging process. And our ceremony will begin at 12:50. Please do not miss it. Please come back by 12:50. It's going to be the very exciting time for all of you. While we prepare the result, we are having a short networking session here. So please talk with all the pitch presentators and make the network. We hope this can be a good opportunity for you to know each other. So let's have this 10 minutes break. Thank you so much. 9JP, a researcher pitch. Judges had a really tough discussion. It was really difficult because all the presenters were great. So now we are going to announce only one grand prize winner. And the prize will be was evaluated by 5 criteria. And just based on that score, the winner was selected. I'm gonna introduce the presenter of the from the judge panel. Koyama-san, Michiko Koyama-san will be the presenter. Koyama-san from the Startup DI Promotion Council. Koyama-san, please be on the stage. And please give the applause to Koyama-san. All right, Koyama-san, after the drum roll,
Yes.
please announce
Got it.
the winner. Drum roll, please. ドラムロールお願いします。
Kenji Suzuki-san, Institute of Science Tokyo from GTIE. Congratulations.
Suzuki-san, congratulations, and please come on the stage.
Congratulations.
Yes, the winner is Suzuki Kenji-san from Tokyo Kakudaiko Institute of Science, Institute of Science Tokyo. Congratulations. 拍手お願いします。Yeah, that is a great trophy. Okay, congratulations. Okay, Suzuki-san, could you give a comment? Yes. English, English, please.
I'm really honored to have this the honor. I would like to thank everybody get involved in this project. Murakami-san, Yoshida-san, and also the people in my lab, clinical collaborators, and also finally my wife, there. So we will make sure to bring our AI-powered diagnosis to every patient on the planet to deserve this award. Thank you very much.
All right, thank you so much. Then Koyama-san, representing the judge panel, could you give some comment?
So thank you very much. On behalf of all the judges, I do have a small memo, so please allow me to go through this, being very respectful for the people. So first of all, thank you all for your presentation today, and congratulations to everybody. It takes real courage to stand here, share your ideas, and open them up to questions and scrutiny. So truly well done. What struck me across all of today's presentation is all the common threads. You're not just advancing research, you're stepping into a much harder space, turning knowledge into real impact. We saw a wide range of domains, from livestock diagnosis, epilepsy treatments and surgical systems, to urban monitoring, energy organizations, biomanufacturing, and cybersecurity, and even sports. Different fields, but shared ambitions, using AI and data-driven approaches to solve complex, real problems. And that's exactly where things get interested, but also very difficult. Because the next phase is no longer about whether your technology works, it's whether it can survive outside the world, outside the lab. The gap between strong ideas and real product is where many great technologies really struggle. I've seen that as being a venture capitalist for the past 11 years. But it's also where the biggest impact is created. So my encouragement to all of you who made the presentation today is, don't underestimate the technology, and don't underestimate the challenges ahead either. Please start engaging early with the real users. That is the really key to the commercialization and business impact. Turning research into a company is not a solo journey. It requires complexity, talent, especially in execution, business development, and productization. So finally, I want to emphasize what you are doing is really matters. So please keep going, keep building, keep testing, and keep challenging yourselves. And I very much forward to seeing you all again. Thank you very much.
All right, thank you so much, Koyama-san. And then let's give final photo session with two of you. And there's a large panel. Please smile. Okay, in addition to the trophy, the winner will receive support from the 9JP platform for the global conference and acceleration program. Furthermore, a 6-month subscription to Startup DB will be provided by 4 startups. The additional prizes for all presenters that will be provided by 4 startups Inc., NEC, and KDDI. That will be announced to all the presented later. Okay, let's conclude this program. All the presenters, great job, and thank you for your great work. And judges as well, thank you so much for supporting this panel. And thank you so much. And we're gonna have the last photo session, but I'd like to conclude this session here. Thank you for joining us. Tomorrow, we will have the startup pitch here at the same time. So please come back again. Thank you.